firstly, I've always noticed that there was such a huge gap when it comes to the information that is available to the people and the information that is supposed to be available to the people. So I noticed that language was a barrier, but I actually never knew, like I didn't identify it at hand. Not until one of my loved ones passed on earlier on this year, and they died because of a condition that was secondary to hypertension. And during the whole funeral process, I witnessed that people don't actually notice the severity of the disease. And I asked myself, why don't these people know, despite information being out there about hypertension and how worse it could possibly be? And I noticed that language is a barrier between, the health professionals and the Namibian people. So with this going on in my head, I asked myself what other conditions that people probably don't know about, and because now the information is available, but it's not available in their languages. So yeah, with that going on in my head, I just, decided to create an awareness program that is tailored for the Namibian people. By that I mean in their vernacular languages, in languages that they can understand. So it was really just, I just identified a gap, and yeah, that is sort of what motivated the whole awareness program.
How will the health information program assist in delivery and access to health information?
When it comes to the program and assisting the delivery of access to health, now this information that I am sort of trying to put out to the people is tailored in languages that they understand. So in health, really, we are trying to combat or fight diseases at their most primary level. So we don't have a lot of, chronic conditions or young people with chronic conditions that could have otherwise been fought in their earliest stages. So the access to this information will mainly just help preventative care. It will foster preventative care in the people before, because I feel like sometimes somebody finds themselves in a hospital bed, but had they known a certain type of information, they would have prevented it. So I think the whole program will just strives to promote preventative care, really strives to prevent chronic cases. So if this information is readily available to the people beforehand, then I think it could make such a great impact in regards to that.
So Heita, can you just tell us what makes your approach to health awareness different from other campaigns in Namibia?
Like I said in the beginning, Kaleinawa's program aims on tailoring the health information available for the Namibian population. Yes, the information is available on prostate cancer, on breast cancer, on hypertension, on diabetes, on antimicrobial resistance, but is it available in a way that people can use it? Is it available in a way that an Oshkwanyama person who doesn't understand English can understand it? Because in as much as everyone else ideally is supposed to, know English, it all boils down to not every Namibian person knows how to speak English, and most of the information is available in English. And also looking at a greater population of people, most people that are prone to illnesses are those that most of the time do not comprehend information given in English. The people in the villages, deep down in the villages, if you break it down to them in a way that they understand, it will make such a big difference. And another thing I picked up was Namibians don't really have a reading culture. So in as much as other awareness programs maybe strive to have posters put up somewhere, they don't really read. Even if you put like a poster that's in Oshiherero at a Herero district hospital, and a Namibian population doesn't have a reading culture, they will not read the information. We have a very short concentration span, so I decided, why don't I make videos? Most of the people are on TikTok these days. Most if not everyone is scrolling through TikTok. So I'm like, if you put information that is readily available in their language on a platform they use on a daily basis, it would make a difference, because these people are using TikTok every other second. But they're using TikTok, but when they go on TikTok, the health information that is available is not available in the way that they understand it. So I think really the difference between Kaleinawa's health program and other existing program is that it tailors the information that is available to the people, putting in mind that Namibians don't really have a reading culture, and most of the time they're using, social media platforms. Because you find that you go to a hospital, somebody came to the hospital, they maybe brought their child there, and there's a poster that maybe describes a certain condition that they're living with. But the next thing, as soon as they get to the doctor's waiting line, the next thing they do is take their phone from their bag, scroll on TikTok. But the poster is seated right there, talking about preventative measures. But if you tailor the information that is available in the way people are in the form that people are using, which is their vernacular languages and the current social media usage, then I think that makes a big difference. And that is really just the difference between this program and other existing programs.
Since we have already started with Oshikwanyama, can you share a moment when you saw the real impact on your program in a community?
So I would say one thing I'm really, really grateful when it comes to this program is I've seen that people are actually listening to the video until the end, because it's like, I think maximum 3 minutes. I'm picking up that people have so many health concerns, and I'm seeing it in the comments. People are, DMing the page on TikTok. So really you can tell that people have so many questions and so many concerns about health that are not addressed, because when they go to the hospital or maybe when they try to Google stuff, it comes in English. So now it still leaves a lot of questions in their mind, but what if this, what if that? People are asking about ways to improve on certain health lifestyle. They are thinking of modifying their, healthy seeking behaviors. But you could tell that this was really a gap, because people cannot go on internet and search about health-seeking behaviors in Oshikwanyama or in Ochiherero or in Damara, because it doesn't exist. So really just coming out to the public and speaking in a native language sort of encourages the people to actually ask out or put out their health concerns, because they feel now they're being understood, or information is actually coming in a language or in a form that they understand. So I think currently where we stand, given that we recently just started, it's one impact that I'm really, really grateful about. Like, I'm seeing patients asking, I'm a patient of this, what can I do better? Or I do this, what can I do better? Or how do I improve on this? So really, that's where we currently stand to community impact.
So how do you plan to involve more local languages in spreading your awareness?
Given that I'm currently at School of Medicine and I see a diversity of tribes, I'll really just want to start here with people who are from, different tribes to actually help me convey the messages in different languages. If you are Herero speaking, and I'm really just seeking for volunteers because I just started, I just want people who are native speakers of their languages, who are from my surroundings now, of course, to convey the message in their languages. If you feel like, and one thing I picked up as well is there are so many other neglected tribes. Neglected by that I mean you don't really find most things tailored in that language. Like, you'd go to a hospital in Windhoek, and maybe if there's things that are not in English, they're probably in Oshiwambo, in Herero, in Damara, or in Afrikaans. But Windhoek really has other tribes, Mbukushu, If right now, to involve more other languages, more other local languages, I just want people to volunteer. So with the same information, we convey it in other languages for the people as well.
And when are you planning to start with the other languages?
So initially I started with Oshikwanyama. The video came out on Saturday, and I have done the video on Friday. So I would say quite soon, in like 2 weeks, because right now I'm currently busy with my third year exams. But once I'm done with that, I would want to collaborate with other people, other medical students that speak other languages, or just other students that are native speakers of other languages, so we can have the same topic addressed for other tribes as well, or for other local communities in Namibia that speak other languages.
So, Ndeshipanda, what is your long-term vision for Kaleinawa's health awareness, and how can the public support this program?
So my long-term vision when it comes to Kaleinawa's health program is really just to have a greater coverage of other Namibian languages, and also just addressing a lot of other health concerns that the public people have. And also, one thing I recently picked up from the Kaleinawa's page is that people have so many questions that are not addressed. So maybe have like question and answer sessions for the page where where maybe I have certain days where people bring in their comments or questions, and with the medical knowledge that I have and also with the help I'm going to get from my doctors, I break it down to the level the nation will understand it, and also in the language they do understand. Also, when it comes to the health awareness program, I'm not sure if it's logical to say here, but I think an online consultant for a Namibian population would really help, because people have so many unanswered questions. People have so many concerns, but they don't really have anywhere to go, because they wouldn't really just go to a random. You cannot just have a concern at home and randomly just walk into a hospital while you're not sick to ask a question. But I think if we have or had like online consultants, it would really help. And also online consultants who speak native languages and who are helping the Namibian nation at that level, because the whole aim is to prevent or to combat illnesses at their most weakest stage, their most primary stage, before they get serious, before they get chronic and all that. So yeah, the whole long-term vision for Kaleinawa's health awareness really is just to increase coverage, increase the number of languages, native languages, and also just cover a lot of other topics that are affecting Namibian people at their most primary level.
Kaleinawa, what messages maybe do you have for the public?
The message I have for the public really is just, I think, okay, now the general public involves, the doctors and the people who are the patients. So I think for the doctor or for the healthcare aspect of the public, it's just that I think we should really utilize social media to its greatest capacity. Recently, I've noticed we can actually have a wider coverage of people through social media. So if we break down information into small portions for the Namibian population, we could really do much when it comes to preventative care. And for the general public, the advice that I do have for the general public is that when this information comes out to you guys, I plead to adhere to the information that we are providing in these smaller chunks that we are doing it. And yeah, if I see adherence, I think it also serves as a way of encouraging me, or rather telling me that the people are listening and they're adhering, and it will encourage me to keep on going with the awareness program and see other areas that require to be addressed. And also the last thing I would want the public to help me with is just bring out the concerns, bring out whatever sort of concern, because if we know what is wrong with the people, then we would know how best we can solve the problem. Because sometimes maybe people present, or the patients are presenting with certain conditions, but there are other things that they are doing besides treatment that we do not know of. So really just, bring it up to the people or to the healthcare, your concerns, and we will see how best to address them for a Namibian population.